Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Jason Kuder. He's CIO at Oak Orchard Health Center. Welcome, Jason.
Thank you. Thank you for having me.
Yeah, excited to have you on the show. Lots happening right now in the world, but before we dive into today's topic, tell us a little bit about yourself and Oak Orchard Health.
As you mentioned, I'm the Chief Information Officer at Oak Orchard Health. I've been there for 10 years now, actually 10 years in October.
Wow, congrats.
So Oak Orchard, of course, is an FQHC in Western New York, where for me, I do a lot of the IT things, right? So the IT things is where I'm at, and technology is kind of what I've been brought in to do.
That's awesome. Well, we want to talk about Sunoh.ai, the AI medical scribe. What went into your decision to implement this AI medical scribe? And really, why did you choose to go with Sunoh.ai?
Yeah, I think for us, closing notes by the end of the day was kind of a high level from our chief medical officer to be able to accomplish. So I think that was one of the major things, or at least the first things that we thought of to be able to do. And this service was something that would actually hopefully benefit for that.
Mm-hmm. So did you look at a number of solutions, or did you just know that it was embedded with ECW and you liked that, or how'd you approach it?
I think you kind of like stuff, if you have a choice, if it's embedded and you can do it, that's probably your first choice. For us, we have a lot of our providers were using Dragon before, so more dictation, not as much AI. So some of them are familiar with the whole talking and being able to do notes with that. So I think between the two, those are really the two vendors that we really looked at when it came to any type of AI capabilities.
Yeah, I love what Girish said in the keynote today. He said, "No more periods."
That's right. No more.
In the dictation, when you just have to say periods, comma, exclamation point.
Very true. It is very true. That's actually one of the things. And when he mentioned that, our providers said the same thing. So it's funny that people would say that.
Yeah, well, I mean, you get used to it, but it's annoying to do.
Yeah, I agree. It seems awkward to me if I had to do that all day. I don't know how they do it.
Yeah, it's amazing how far we've come. So tell me about what has been the impact of Sunoh.ai on your providers, and how much time are they saving? How are they reacting to it?
Yeah, so we've been at it for 3 months now.
Wow.
So we have about 20 providers, medical providers. Most of the feedback that we're getting, definitely 100% across the board, providers love it. They would recommend it to another provider, which is probably allowing us to be able to expand more and a little quicker, because now the word of mouth is out saying that this is going to be something that's going to benefit them.
Then you have jealousy. Why don't I have that? Yeah.
Right, that's right. That's how it works, for sure. What other things? For me, the amount of time, we give out a survey. So if they've used it at least 50 times, we give them a survey. And so I probably should have narrowed down the windows, but the majority of them are saving 1 to 5 minutes per encounter. So it'd probably be a little better if maybe I did a 1 to 2 or a 3 to 5 kind of thing. But 1 to 5 is about 60% of the providers are saying that they're saving that much.
Interesting. And you started to try to get the notes closed. Are the notes closing quicker with this?
That's probably one of the things we're still trying to gather data for. AI is actually helping them close the notes faster, but it doesn't change their habits, right? So their habits are really the piece that I didn't really factor into that. I just figured that if you have something that's generating, 90% of what you need to do, that you just want to get it done, that last 10%. And so we still have providers that, either will save it for a specific amount of time, whether they do it on their admin time and do it at that point. But I think that's probably one of the things I did not think about when we were implementing this, as far as changing the habits of the providers.
It reminds me of a provider I worked with. He would leave his notes open, way too long.
Right.
And it's because he loved his travel.
Yeah.
So he would spend his free time checking out travel sites and travel buddies instead of locking the notes. I saw him about a year or two later. He's like, "John, you'll never believe it." I said, "What?" He said, "I actually closed my notes." So, it is possible to change those habits.
It is. It's a changing of habits. So, yes, not thinking about it at the time and thinking that this was going to be the thing to allow them to close the notes instantly. We're still working on that piece, I think.
Interesting. So we have the time savings. I think that's interesting. Of course, being able to close notes. Any other benefits from the AI medical scribe and clinical efficiency, other things?
Yeah, I think for me it's the mental strain. So one of the things I did not think about, me being not being a provider, having to think about writing 23 HPIs in a day, right, and trying to come up with 23 paragraphs of things right throughout your day. And having that mental strain to be able to put all those sentences together to make something coherent 23 times a day. That I think is what I've heard the most. And that's kind of hard to try and get quantitative data for.
Sure.
But all of them are saying that at the end of the day, mentally, they didn't have to write 23 HPIs, so that by the end of the day, they feel like they've accomplished something, not as mentally drained. So to me, that's a win for me.
Yeah, that's a big win. And maybe also having to remember each one,
Yes,
whereas now
absolutely.
you have the full transcript.
The whole transcript and the recording, absolutely. That's, for me, when we onboard a provider, that's one of the first things that I talk about is to, it's going to record it. So you can always go back to it. It's searchable. You can actually type in, if you mentioned salt in the conversation, you could type in salt and figure out what we talked about when it pertains to salt.
Yeah.
It's very cool.
That's really neat. Well, let's shift gears a little bit and talk about some of the other products you're using. Hilo is a big one that we've heard talked about here at the Health Center Summit. Talk about how implementing Hilo Check-in, Hilo Pay, you've even done the kiosk, have kind of benefited your organization.
Yeah, I think prior to 2025, we were kind of in this weird state where we kind of threw technologies out there because of something X factor, whether we lost a lot of staff. It's usually probably the main reason why something gets thrown out there. We've implemented things, but maybe not to the best of its ability. So for us, it's been more of at least in the beginning, is kind of a relaunching of things, right? So knowing each of the service features within each of the Hilo products and what they can do for us as far as saving time for our staff, and then how does it make it more efficient for patients? It's probably our first thing that we've been looking at. In 2025, we definitely are launching a slew of Hilo products. So just about all of them, with the exception of Genie, since it's so new, we are actively have an agreement with, and we're working on the configuration pieces of it. So it's definitely exciting. It's a lot on our plate, but we are looking forward to it.
Yeah. And how have patients reacted? We talked about the provider reaction to Sunoh, right? How have patients reacted to both the AI medical scribe, but also, as you continue to evolve your practice?
Yeah, the medical scribe, I thought we would get more pushback. We've had no complaints, no pushback with patients. AI seems to be a scary word. At the same time, it's an exciting word, right? So you would expect maybe a little more pushback from people who don't understand the technology. But they've been very receptive of the technology, knowing the fact that I think maybe the way that the providers word it, where it's, hey, this is going to help me create the notes and make sure that I have everything correct from what you're telling me. I think that puts them a little more at ease, and so then they go with it. So
yeah,
good.
I think we've seen over and over in healthcare that if the patient will benefit from it and they think that you've put some effort to ensure the privacy of it, then they're happy to do it.
Yes, I agree. I agree with you 100%.
That's awesome. Well, Jason, I appreciate you taking time to take time out at the conference to come talk to us and share your experiences. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, Jason.
Thank you.